So, good evening, friends. Let us start our unknown class right away. So, where were we? We were studying aphorism number 6. We just had one short discussion yesterday on the aphorism 6. Let us take this aphorism to the next level. Regarding the medical observer, I gave you one reference about the medical observer in an article by Dr. Henman in his lesser writings. I'm sure many of you must have gone through this article, but what I understand is this aphorism cannot be complete without really going into that article. So, to start with, it will be really nice just to have a quick glance of that article to be aware that how to be a medical observer. It is very much necessary for a homeopathic doctor to work. Until and otherwise, we read that article, we cannot appreciate the footnote given here. This footnote is of immense value nowadays, given by Master Henman with aphorism 6. So, as we discussed yesterday, the unprejudiced observer, well aware of futility of transcendental speculations, which can receive no confirmation from the experience, be his powers of penetration ever so great, takes note of nothing in every individual disease except the changes in the health of the body and the mind, that is, in bracket, morbid phenomena, accidents, symptoms, bracket closed, which can be perceived externally by means of the senses. That is to say, he notices only the deviations from the former healthy state of the now diseased individual, which are felt by the patient himself, remarked by those around him, and observed by the physician. All these perceptible signs represent the disease in its whole extent, that is, together they form the true and only conceivable portrait of the disease. Now, as I told, let us be first the medical observer. And what is this very good medical observer going to teach us? Yes, I got this article on Whole Health Now. I'm reading this from the Whole Health Now. And I'm sure that this should be verbatim as in the lesser writings. So let us just have a glance of the medical observer by Dr. Henry. In order to be able to observe well, the medicinal practitioner requires to possess what is not to be met with among ordinary physicians, even in a moderate degree, the capacity and habit of noticing carefully and correctly the phenomena that takes place in natural diseases as well as those that occur in the morbid states artificially excited by the medicines when they are tested upon the healthy body and the ability to describe them in the most appropriate and natural expressions. So he says that such qualities which cannot be seen in the ordinary school practitioner, the one who is practicing homeopathy must have. You cannot dispense with, you must require, it is essential. What exactly happening when a patient coming to you with certain complaints, how accurately you should be in habit of noting them down. At the same time, if you are a homeopathic doctor, you need to learn essentially the methodology of proving of a medicine. And while proving a medicine, you should be very, very accurate observing the changes occurring at the time when proving is going on. So, going further, in order accurately to perceive what is to be observed in patients, we should direct all our thoughts upon the matter we have in hand. Come out of ourselves, as it were, and fasten ourselves, so to speak, with all our powers of concentration upon it, in order that nothing that is actually present that has to do with the subject and that can be ascertained by all the senses may escape. So, simply, when you're with your patient, you should come out of yourself and then, with all your senses, you must concentrate on the patient. And when you are concentrating on your patient with all your senses, what is happening around? Anything fallen, somebody shouting, any noise, any music, this or that, it should be like as if it does not exist. When you are with your patient, the first thing is this kind of concentration. Have that focus, absolute focus on your patient, nothing else. Poetic fancy, fantastic wit and speculation must for the time be suspended. No such exaggeration of any kind of poetic fancy, fantastic wit and speculation, all that is not to be there at all. It should be suspended. And all overstrained reasoning, forced interpretation, and tendency to explain away things must be suppressed. You are seeing a symptom and you are yourself saying, this is because of this. Forget about this symptom. Not really required. The duty of the observer is only to take notice of the phenomena and their course. His attention should be on the watch. Not only that nothing actually present escape his observation, but that also what he observes be understood exactly as it is. It's very important that you should be noting down, you should be watching your patient with your full concentration, with all your senses, that whatever he is saying, that his exact words, with his expression and the body movements, everything that is to be noted very carefully. We need to learn something that it is sometimes difficult initially. Patient is saying something, and we then, in the order of writing whatever he is saying, our focus, our watch, our gaze to the patient is lost. And so many of the activities of the patient are really vanished from our observation. So initially, those who are mm, students, those who are learning the case taking, better that they should do this case taking in a duet. I mean that two persons together should do this. One is focusing on the writing, and the one who is focusing on watching the patient, questioning the patient. So if you do this, definitely you cannot really be away the focus. So that is something very important. And there are many activities. One example is here in live chat, swimming. When you swim, when you learn swimming, when you learn driving a car, learn driving a cycle, your whole focus into that. So like this, we also need to be very focused and note down everything. We should be the patient watcher. The way we should watch that what are his expressions, movements, activities, words, how his eyes are saying something, how his lips are saying something, how his hands are saying something, everything. Now, this capability of observing accurately is never quite an innate faculty. This accurate observation, art of accurate observation, we need to develop. We need to have that training to learn this accurately observing technique. We are born with the technique of observation, but then it requires training, as I told yesterday also. It must be chiefly acquired by the practice, by refining and regulating the perceptions of the senses. We need this kind of training because there's a book of surgery, clinical surgery by Kedas. There is a very apt saying for this purpose: what mind does not know, eyes cannot see. So, for that purpose, we are having many kind of smells. That the sweat smells sour, the sweat is offensive, fish brine odor. We have such kind of symptoms in our Mathematica. But have we really trained our olfactory sense? What exactly is what? We are to experience that. Then only we'll be learning. So we need that particular training to regulate our perceptions. That is to say, here Henry says, I mean by exercising a severe criticism in regard to the rapid impressions we obtain of external objects, and at the same time the necessary coolness, calmness, firmness of judgment must be preserved, together with a constant distrust of our own power of apprehension. So here he is saying that we may be uh, within us having some kind of apprehensions and reasons and so many other issues of the life, personal issues of the life of the physician. Then you should be aware that all these activities will not really allow you that kind of coolness, that kind of firmness, that kind of sense of goodness, so that you can be very apt observer. Like for example, it's a time I'm to go in my cab. The cab goes at 4 p.m. I may miss it. He will leave me. So I'm just finishing the case. No, then it is going to be a disaster. You can't observe the case. That means that we are to constantly focus ourselves, criticize ourselves. That are we really observing the thing exactly and accurately and in all entirety, or we are missing. Like for example, patient is telling pain in the joints, then we are able to get it that yes, knee joints, but then we forgot right or left. We forgot that on the inner side or the outer side of the place he's having pain. Did we really ask exact sensation? Did we really mention and asked him regarding the modalities of the pain, extension of the pain? Anything missed? That means you're going to miss the indicated remedy. The vast importance of our subject should make us bestow the energies of our body and mind upon the observation. And great patience, supported by the power of the will, must sustain us in this direction until the completion of the observation. This is the very important point where the physician has to learn that before learning what is required, you are to take care of your energies of body and mind, that I should be extremely calm and patient, and I should be having that determination, that will, which is going to sustain me, that I am to ask all these details. Generally, initial days, what happens? We are unable to take down the exact noting of the patient. And we reach to the senior doctor and says that this patient is not telling exactly all. It is nothing but that we were not determined to ask. We need to be very, very determined and focus our energies of body and mind for one and only purpose, to observe, to educate us for the acquirement of this faculty. An acquaintance with the best writings of the Greeks and Romans is useful in order to enable us to attain directness in thinking and in feeling, and also appropriateness and simplicity in expressing our sensations. The art of drawing from nature is also useful as it sharpens and practices our eye, and thereby also our other senses, teaching us to form a true conception of objects and to represent what we observe truly and purely, without any addition from the fancy. A knowledge of mathematics also gives us the requisite severity in forming a judgment. See, I told in my previous lectures that we need to be a, as a homeopathic physician, need to be a literary person also. We should be reading the literature. He mentions here that best writings of the Greeks and Romans, they are useful. We are rather more enriched. We have so much of writings in a very exact manner of this area of Indian civilization. So we have rather much more records. Indian literature, Greek literature, Roman literature. We should get some time to read all these things. It will be giving us the exact understanding how to write something very straight as a fact. Like, for example, we are in the habit of writing regarding the appetite good, appetite not good. These remarks are not going to help. These are the remarks by my fancy. Then we are writing thirst. We are writing poor thirst, less thirst, more thirst. Some of the vague terms we use for such a very special kind of things. We need to know exactly that what is to be written. We must be knowing the appetite and the hunger. What is the difference? And how to write the fact? Because when patient says, I eat well, it does not convey much about his appetite, which can be useful for us. Then we need to exactly know the kind of questions we are putting to the patient regarding the appetite, regarding his thirst, regarding his sleep. How do you sleep? I sleep well, doctor. But this is not the way regarding the sleep. Do you sleep? The thing starts with this. Yes, I sleep. What is the time around you sleep? Go to sleep. What do you do before going to the bed? When you go to bed, how you lie? What is your position? You just go into sleep immediately or you take time? What posture position you acquire in the bed to sleep? So there are so many questions regarding the sleep to be asked. We must be knowing this. So this is very important to really read something beyond our only medical books. It gives us the idea regarding certain points, and Hahnemann is mentioning especially the Greek and Roman literature. There are many such clinical examination books, like we all read Hutchinson, good. Then McLeod's Clinical Medicine, and all such. They are very good piece of understanding. They tell all these points. They tell right facts. But then how to write fact? This is only available because this is not the purview of that book. How to write fact we can learn from the literature. So that we should be finding out and reading. Then suppose some fine morning wake up, go outside means on your terrace or on your roof and see what are you seeing? How is this morning? Try to write down how is this morning. This kind of activity is going to give you the exact idea to write the facts. Try this. It sometimes becomes difficult. Oh, I cannot write how is this morning. Or maybe we will be able to write down some few sentences of not really describing much. That picture of the morning should be in such a way that you will be able to write to your friend. For example, suppose you only have a phone which is having a text message facility, does not have the facility to get picture and send picture. In that circumstances, you want to tell your friend that how is the morning today at 6 a.m. How will you write so that he can feel like you the morning as you're feeling yourself? That is the idea to say. It requires lot of sharpening of your senses, eyes, ears, and everything. And in this fashion, sometimes the knowledge of mathematics becomes very important. Like if you go to the very classical books of the clinical medicine like McLeod's and all, they go means you have seen a lump or a growth, and you have taken the idea just by touching and palpating that this size is, but then that is giving you the exact way of measuring it. If you write down proper measurement, knowing the measuring techniques of the things which are available, that lump or the tumor or whatever, the next time when you are going to measure, you will be quite certain that after the treatment, it was earlier say 1 centimeter, now it is less than that or more than that. That is going to give you a very clear idea. There are many usage of the mathematics, and in homeopathy even the dose has got lot of mathematics we should be knowing. And in the clinical medicine, you know that somebody is coming to you of a very young age boy or especially a girl and looking forward that my height is a issue. Obviously, you don't give medicine to increase the height, you only give the medicine to really help the system if any obstruction to the height that can be corrected. So, how will you know yes, height increased? That possibility is with mathematics only. So it gives you a lot of corrections and the exactness. Thus equipped, the medical observer cannot fail to accomplish his object, especially if he has at the same time constantly before his eyes the exalted dignity of his calling. Here in this paragraph, he says, again taking us to the aphorism one. When you take this pledge that my job is to cure, then if you are unable to understand the exact phenomena, how can you cure? So this calling, this mission drives you for the purpose of knowing this exact phenomena. He knows that observations of medical subjects must be made in sincere and holy spirit, as if under the eye of all seeing God, the judge of our secret thoughts, and must be regarded so as to satisfy an upright conscience, in order that they may be communicated to the world in the consciousness that no earthly good is more worthy of our zealous exertions than the preservation of the life and health of our fellow creatures. See, one is that your internal conscious feeling that you were into the pledge of mission of cure. At the same time, you are under the watch. If nobody, that Almighty is watching you, how you are behaving, how you are going into the conversation with the human being, suffering human being, who is, God is loving all His creatures, including human being. So if you're treating human being shabbily, not really seeing him the way it should be, definitely you will be in lot of con- conscience issues that you have done some wrong. You may get guilty about the shortcomings, which is not really required. The best opportunity for exercising and perfecting our observing faculty is afforded by instituting experiments with medicines upon themselves. He gives another idea. Why don't you prove medicines on yourself? Because if you really experience the medicines, proving of the medicines on yourself, nothing great than that. I tell you one small story that comes from the Greek mythology. In every region, in every civilization, They developed their art, culture, hence they developed their medicine also. So Indian civilization has its medicine named as Indian medicine. Similarly, Greek medicine, Chinese medicine, Egyptian medicine, they are the earlier most, initial civilizations of the human race. So in the Greek mythology about their medical art, see, all civilizations agree to one point, that all these medical art are divine art. They come from the heaven. The human race, any member of the human race has no such capacity to develop medical art. There no civilization differs, hence for every civilization the medicine developed, they have their gods. Similarly, in the Greek mythology, they have a god. Like in Indian medicine, the god of medicine is Dhanvantri. So the Asclepius is the god of Greek medicine. This god of the Greek medicine, point is that history goes further. How this god Asclepius learnt the art of medicine. So that mythology says that he learnt the art of medicine by Centaur Chiron. There is a character, Centaur Chiron, who is upper half of the body is human being, and the lower part of the body is horse. He is half man, half horse. That character is named as Centaur Chiron. And that Centaur Chiron suffered because Centaur Chiron is a uh, divine and entity which cannot be killed. But then Centaur Chiron suffered with lot many injuries and diseases. And having those inflictions on him, on his body and the mind, he found out amongst all the herbs the ways and methods of the treatment. And he became the wise. And then he taught to the Asclepius the art of medicine. Means the whole idea is to understand that if, like Centaur Chiron, we subject ourselves to the difficulties, that is the proving, we will be adding to our knowledge the exactness. What this medicine is doing with us, exactly we will be able to experience. Then, if suppose some those who are not really able to do this out of the lack of courage, lack of confidence, fear of getting some difficulties, though it is not correct, then at least they must read the provings, that is the book Metromedica Pura, chronic diseases, hearing guiding symptom. But the first is Metromedica Pura. We will be knowing exactly how the symptoms are noted, what are the details noted, how it is accurately in a factual manner written by Master Hand. That is something very important for all of us to know. Then, next para, by persevering in this careful investigation of all the changes that occur within and upon himself, the experimenter attained the capability of observing all the sensations, be they ever so complex, that he experiences from medicine his testing, and all, even the finest shades of the alteration of his health and of recording in suitable and adequate expressions his distinct concept of them. So this is what we discussed, that how it is going to help us in the understanding when we are proving the medicines on ourselves. Thus, only it is possible for the beginner to make pure, correct, undisturbed observations, for he knows that he will not deceive himself. There is no one to tell him aught that in untrue, and he himself feels, sees, and notices what takes place in and upon him. He will thus acquire practice to enable him to make equally accurate observation on others also. When I myself become a center chiron, I will definitely learn observing others in a very exact manner. By means of these pure and accurate investigations, we shall be made aware that all the symptomatology hitherto existing in the ordinary system of medicine was only a very superficial affair, and that nature is born to disorder man in his health and in all his sensations and functions by disease or medicine in such infinitely various and dissimilar manner. Like if you go into the old school books, even now, whatever may be the books of the practice of medicine, they are not with that exactitude as required by the medical observer. Now he gives an example of a portrait painter, somebody who is making a portrait of somebody, like somebody is drawing Mahatma Gandhi, somebody is drawing some very great statesman or a actor or a actress. Then when we see that picture, we are able to appreciate that how exactly he is drawing the portrait of that personality. How we see that? We are able to see that the expression of the face, which is by a certain kind of crease and lines on your face, on your forehead, on your cheeks, on your nose, like that, they are very exactly drawn. It is exactly the same way that a homeopathic physician must be doing this. Let me read. No portrait painter was ever so careless as to pay no attention to the marked peculiarities in the features of the person he wished to make a likeness of, or to consider it sufficient to make any sort of pair of round holes below the forehead. And like this, he is describing that no painter is doing this. No naturalist even went to work in this fashion in describing any natural product, such as never the way in which any zoologist, botanist, or mineralogist acted. I think every one of us really can go back and learn that we all read zoology and botany, and we couldn't really understand. We can remind us that how exact this botany was, how they're explaining each and every thread of a flower or a plant or a seed. So when botanist is so particular, zoologist is so particular, why a medical observer is ignorant? That is what the old school have done. Let us not do it. And when saying let us not do it, we cannot help it. It is not required. And it is only the semiology of the ordinary medicine that went to work in such a manner when described morbid phenomena. That's what I'm saying. That is where the difficulty is. The sensations that differ so vastly among each other, and innumerable varieties of the sufferings of the many different kinds of patients were so far from being described by words or writing according to their divergence and varieties. There are so many things, like if we read now, the description of syphilis in practice of medicine and pathology. It is altogether different how it was earlier. Initially, initially it was such a virulent disease. Now it is subdued, pattern changed. But until and unless we go into so much of detail of the disease, we cannot perceive this kind of changing pattern in the diseases. Why? When we are writing so much, why can't we write that earlier the disease was like this and now it has become like this? There is a change in the pattern. But then such kind of descriptions are not there in our practice of medicine books. And there are so many of details for every complaint. What kind of perspiration in the fever, where are you feeling more hot, and are you sweating? If sweating, where? Whether you start sweating from your thighs or from your back or from your shoulders or from your spine or from your head, all these details are necessary. Going next, with such superficial expressions, the innumerable varieties of sufferings of the patient were disposed of in a so-called observation, so that, with the exception of someone or the other severe striking symptoms in this or that case of disease, almost every disease pretended to be described is as like another as the spots on a die, or as the various pictures of the dauber resemble one another in flatness and want of character. That's what I'm saying. They are unable to express exactly the phenomena. So, like this, has been told that whatever the mistakes they are doing, it is the immediate understanding for us that we cannot afford such kind of difficulties. The most important of all human vocations, I mean, the observation of the sick and of the infinite varieties of their disordered state of health, can only be pursued in such a superficial and careless manner by those who despise mankind. For in this way, there is no question either of distinguishing the peculiarities of the morbid state or of selecting the only appropriate remedy for the special circumstances. See, this is how the old school deceived their patients. The conscientious physicians who earnestly endeavors to apprehend in its peculiarity the disease to be cured, in order to be able to oppose to it the appropriate remedy. If you want to have the exact simillimum for the patient, will go much more carefully to work in his endeavor to distinguish what there is to be observed. Language will scarcely suffice to enable him to express by appropriate words the innumerable varieties of symptoms in the morbid state. No sensation, be it ever so peculiar, will escape him, which was occasioned in his feelings by the medicine he tested on himself. He will endeavor to convey an idea of it in language by the most appropriate expression in order to be able, in his practice, to match the accurate delineation of the morbid picture with the similarly acting medicine, whereby alone, as he knows, can a cure be effective. So true it is that the careful alone can become a true healer to diseases. This line needs the repetition. So true it is that the careful alone can become a true healer of diseases. This is the importance of only one word, observer. And in that, really meeting all these points we read in this article just now, you have to be unprejudiced. I explained you yesterday that what is unprejudiced. Just repeat in a word that you should not make any judgment in advance. What? You have to simply note down the changes happening in that patient from the time he felt some kind of alteration in his health. Generally, it is felt in the body and the mind, because gross is known first, subtle is known later. That is the order generally, maybe otherwise. But generally it is like this. So note down those changes. And these changes are first to be noted as told by the patient. Then the second importance regarding the people surrounding him, like family members and others. And then my turn comes at the end, at the third place, that what are the observation of the physician we have to note down. It adds to the observation what I make and the examination I do for the patient. General physical examination and systemic examination. That everything I have to note down. And when you get all these details right from the details given by patient, family members, and all you observed and noted, all together is a phenomena, and this phenomena is called the portrait of disease. This is the understanding of this aphorism. If you find any other questions here, you can write me in the chat box. We just go quickly to the footnote of it. I hope you all are not tired. The footnote goes like this: I know not, therefore, how it was possible for physicians at the sick bed to allow themselves to suppose that without most carefully attending to the symptoms and being guided by them in the treatment, they ought to seek and could discover only in the hidden and unknown interior what there was to be cured in the diseases, arrogantly and ludicrously pretending that they could, without paying much attention to the symptoms, discover the alteration that has occurred in the invisible interior and set it to rights with, in bracket, unknown medicines, and that such a procedure at this could alone be called radical and rational medicine. So he is again pointing out how irrationally they were calling themselves rational. He is little sarcastic here. Like, let us take an example to understand this paragraph. A patient comes, small, say, small child come, a boy come of some 8, 9 years of age, and complaining pain abdomen, and you are examining. So many of the clinical medicine books says the examination of the abdomen is a very, very tricky matter. They compare this chamber of abdomen as magic chamber. Sometimes it becomes so difficult. The very learned people writing books say so. So you can understand that when a patient comes with the pain abdomen, and when you say as a physician that what is wrong, I am unable to make out, you need to know, you need to go for a ultrasound or an X-ray or whatever is required. Such kind of activity is really the demeaning. It is not really good for the physician to understand, and he must be able to answer that why he is not able to understand the case clinically. This is the most important shortcoming, because sometimes ultrasound is saying there is a stone, but suppose if stone is only in the kidney region of 2 mm, 3 mm, most probably it cannot cause that pain, and then we mislead. So many of the cases I have noticed. One patient was coming to me. She herself is a doctor, and she was having a pain on the left side of his hip, and she underwent so many of investigations of MRI and every sort what is available. Then something comes, but then it does not correlate with the pain. It becomes very difficult for understanding this. Point is to understand, going into the interior of the human being, going into seeing the vital force. If you think you can understand the disease. It is not true. Even if you know exactly what is this, then just imagine you are able to diagnose after the ultrasound, this is it. But then, how will you treat it? You again need to examine and know the exact phenomena to find out the right medicine. Because the findings of the MRI or the ultrasound not really going to give you the indicated medicine. And but then other side, the other school nowadays even, they started believing and their practice is such, they feel that symptoms are misleading. They are the words of so many great Western medicine doctors. Symptoms are misleading. Only investigation helps. But then symptoms are not misleading. It is the me, it is the physician who is not a careful observer, who is not the right, judicious, the apt medical observer. So symptoms are never misleading. Symptoms tell you the truth. And that is the absolute truth. Provided you must know how to read, how to understand, how to decode the symptoms. So, this is what he wants to say, that the old school physicians, right from the Hahnemann's time, they were trying to make the patient understand that we have seen inside, you forget symptom, we have seen inside. And they were misleading the patients because exactly you cannot understand the disease without the understanding of the right phenomena. If you read this paragraph again, now you will be able to understand what I am saying. I think, hope you do it yourself. Next, is not then that which is cognizable by the senses in diseases through the phenomena it displays, the disease itself in the eyes of the physician, since he never see the spiritual being that produces the disease, the vital force. He is giving the understanding regarding the vital force, the spiritual being. As I told you one day about human being, this is the being, vital force is the being part. And cognizable means awareness. So Hahnemann says that is it is not enough to cognize, it is not enough to be aware by the senses about the disease, by understanding the exact phenomena of the disease, instead of going into and trying to see this spiritual being, that this vital force. Nor it is necessary that he should see it, but only that he should ascertain its morbid actions. This is not necessary to see this spiritual being. What is necessary? That he should ascertain its morbid actions. It is expressing vital force, all deviations it is expressing. You should be able to ascertain it exactly because it has got symptoms, the morbid actions, in order that he may thereby be enabled to cure the disease. That is the only path, the only way to cure the disease. What else will the old school search for in the hidden interior of the organism as a prima causa morbi, whilst they reject as an object of cure and contemptuously despise the sensible and manifest representation of the disease, the symptoms that so plainly address themselves to us. What else do they wish to cure in diseases but these? And when says, what are you going to see inside? We need to go for your endoscopy. Do it. You have a voice, hoarse voice, your voice is affected. We need to do the endoscopy or laryngoscopy to see what's wrong with your larynx. All right, it is done. What you found? There are certain kind of warts on the vocal cords. Now you're saying we will be doing surgery to correct it. Then is that so easy? If it is done, are they not going to grow further again? And like this, there are such so many conditions that going into so much of details inside doing bronchoscopy, doing this scopy and all those scopy. But then I found they simply go into the confusion, and but then nothing comes up to cure. So Henman says you are understanding symptoms as misleading, and you're trying to go inside to find out the primary cause of the disease, and you will remove that. Like example, I gave you the vocal cords, the warts on the vocal cords, the voice. The reason is this what, but why this what has come? Why this vital force, this spiritual being created such growth in the in this larynx vocal cords? Why? That is not answered. So ultimately, they simply deceive. They simply do a contempt for their patient, and ultimately, that correction of the disease, the mission of cure is not really achieved. What else do they wish to cure in diseases but these? And mean says, what all you have to treat, remove all the symptoms, that phenomena, because that is the ultimate total disease itself. If you are able to collect and write and understand the exact phenomena of the disease, that exact symptomatology in its whole extent, like it is pain, what time it is, when and how it aggravates, ameliorates, side, extension. At the time of pain, how is your mood? When there is no pain, how is your mood? What is the character of the pain? So much of details. All those details, if we are able to understand, we will be able to find out in homeopathy the exact medicine. Give that and it will go away. But then the other school, what is happening, you know it well. Then here, when it is ending this footnote, there is one asterisk, if you see. This asterisk means that another paragraph is added here in the sixth edition. What is that? Let us read this also. The physician whose researches are directed towards the hidden relations in the interior of the organism may daily err, but the homeopaths who grasp with requisite carefulness the whole group of symptoms possess a sure guide. And if he succeed in removing the whole group of symptoms, he has likewise most assuredly destroyed the internal hidden cause of the disease. This sub footnote is entirely omitted in the sixth edition. So this paragraph was there in fifth edition. I'm sorry I said wrongly. This whole paragraph was there in the fifth edition, which was removed from the sixth edition. It is in reference to one Dr. Rao, and he removed this. And the purpose here writing is that the physicians who go into the interior, they are making daily error. How it is understood nowadays, they make regular mistakes. Like for example, you take all the editions of pathology, you will come to know how they were changing their understanding regarding the disease. And because of their all the time in the name of new research, they come up with so many different explanations, and it is always changing. But then a homeopathic doctor who is simply noting down what is the complaint in the exact natural language of the patient, knowing all the modalities and everything, collecting the whole phenomena, matching it with the phenomena of the medicine, known medicine. That means the records, the phenomena of the medicine recorded in our Mathematica, we match and give. It removes the disease from the interior as well. Does not mean that you are treating symptoms. Sometimes some homeopathic doctor feel they are treating symptoms. No, you are not giving symptomatic treatment. You are giving treatment on totality of symptoms. And once you are able to understand exactly regarding the totality of symptoms, that we will be coming in the seventh aphorism, you will stop saying that we are symptomatic treatment. So this is a very short nutshell understanding about the aphorism 6. Here and after, I hope every one of you, and including me, we will try to be the medical observer, the unprejudiced medical observer, who will just keep straight his all senses on the patient, watching him so well that he should be able to collect the whole phenomena of the disease in a very exact manner so that he can match it. And he will focus giving the due regard and giving the due regard that who should be noted first, whose symptoms are of prior importance, that is of the patient who is suffering, then their family, those who are around him, and then make your observations, write your observations and examination points that will collect together and make a portrait of the disease. We will be now going further in our next class, aphorism 7, regarding the totality of symptoms. And we will learn that how this portrait of disease, how we extract, how we carve out the right totality from the portrait. That we will be going next. Now, anyone, if you have any questions, comments, points to mention, I'm looking forward in the chat another 1 minute, 2 minutes, so that we will be able to enjoy your comments or we will be able to answer your queries. So anybody, if you have any questions, write me, and we're going very steadily, very simplifying things and understanding things in the exact manner, and that too in a manner so that it should be applicable even today. Sometimes it is understood that it is an old book, but my understanding is that it is still the most latest book in the medical art. So I hope you are really enjoying these lectures, the previous lectures also. I always look for your comments. It gives me lot many encouragement for preparing for the next lectures for all of you. So looking forward for your comments in the comment section, and thank you very much everyone for patient hearing me. Catch up tomorrow. Thank you everyone. Bye bye.